did your first procedure where we did your abdomen, waist, and hips all the way around back on February 28th. Is that correct?
Correct.
So we took off a total of 5 liters at that time. Wow, that has to be a huge change.
I'm so happy. I can't tell you. I'm ecstatic.
Made a big difference,
Oh,
huh?
definitely. I could tell right away, right after you were done.
Really?
Mm-hmm.
Yeah, right now you should be probably about 50 to 60% healed, so it's only going to get better and better from this point.
Yeah.
Great. All right, so today what we're going to do is you come back and we're going to do the posterior arms, the back of the arms,
Right.
and we'll stand you up here in a second to take a look. Okay, so this is the part that everybody hates when the weight from the arms start to pull the arms down. And, you know, it's amazing, and the patients out there will see that when we use very small instruments, we get an amazing amount of skin retraction. There's a couple factors that lead to the arm sagging, and it's weight, gravity, and skin tone. Well, we can't change the skin tone. We certainly can't change gravity because we live on the earth, but we can change the weight in the arms. And in most people, the weight plays a very important factor in how much the arms fall down. So just by releasing some of that fat, you're going to see amazing change in the back of your arms, how much they're going to come up.
I'm excited.
All right, you ready to go?
Definitely.
All right, man. So the first thing that we're going to do is we're going to make our little incisions in the skin, from which we will add the local anesthesia to provide all of the numbing effect of the arms, so that when we actually do the suctioning, you're not going to feel anything at all. Okay?
Okay.
You remember this part when we did the
Yes.
abdomen? Okay.
Yeah,
So
it wasn't.
nothing. Just a little poke here in the skin. Almost feels like plucking a hair.
Right.
So that's 1, 2, and then my typical approach is to make 1/3 incision right back here.
Oh, okay.
So that will be your only 3 openings in the arm. As when we did the other parts, we just use a very small incision. Just a little 2mm dermal punch biopsy. We don't use any scalpels or real sharp instruments during the procedure at any time.
Right.
Okay, we're going to start putting in the local anesthesia. So how would you describe this part?
Just pressure. You just feel pressure.
Mostly pressure?
Yeah. And then now that pressure has lightened up, so I'm not really feeling anything.
Good.
Just still a real light pressure, that's it.
Yeah, you'll find even doing the arms much easier than the process, much easier to go through than even when we did your abdomen and things.
Right, and the ab was not, yeah,
Not too bad.
no, not at all.
The solution that we're injecting serves 2 functions. The primary function is to numb the fat and provides total anesthesia. So we really don't need any other ancillary anesthesia during these cases. The other very important function of Dr. Jeff Klein's solution that he described or invented, called the tumescent solution, is that it constricts or shuts down blood vessels. That's because of the adrenaline or epinephrine in the solution. So during the procedure, and as you probably saw when we did your abdomen and waist, there's a very minimal amount of blood loss. And that means a minimal amount of bruising and therefore a little minimal amount of post-operative discomfort.
I had no bruising after my abdomen, none. I was amazed.
And that's an individual thing, bruising and swelling. It's certainly different from one person to the next. But if you had that minimal amount with the lower areas, you can probably expect the same thing up here.
Right.
If someone has fat on the back of their arms, they almost inevitably have a little ring of fat on the back side of their arms. We call it the posterior axillary fat pad, or just a little fat pad that's on the back of the armpit. So I always feather it in and do a little bit of liposuction right back here on the upper back. This is the kind of the boring part with the procedure, putting in the anesthesia. It takes a bit of time, but the benefits we get from keeping you wide awake and using only local anesthesia are tremendous. The biggest benefit is that you have muscle tone. You have cooperation from the patient. So during the procedure, I'll have you get in all sorts of positions and flex, tighten your arm, so that I can see the results that I'm achieving as we're getting the procedure done, rather than sending you home and 3 months later coming back and saying, oh doctor, you missed a spot here or this. Liposuction is never perfect, but this just gives us our best chance at achieving close to perfection on the very first procedure.
And I'm glad, I prefer this method, that I'm awake and I know what's going on.
Makes you feel a little more comfortable.
Yes.
But you remember when we did your abdomen, where I had you do a little half sit-up, or I'd have you flex or tighten, get in certain positions. That really allowed me to get that extra bit of fat that I probably would not have been able to get with some of the deep fat layers that I wouldn't have been able to get if you were under general anesthesia. Yeah, this is the fat that's exactly right. I want you to kind of tighten your arm muscle for me. Good. That really allows me to get a good, nice little rounded contour around this elbow, because there's nothing worse than doing good lipo around the arm and then leaving a significant fat pad around that elbow. So you can see our incision sites are almost negligible, almost not even noticeable at this point. And then over the next couple months, this is how lipo heals itself. The skin is going to come up. And we'll bring you back here in about a month, and we'll show everybody what it looks like. But just a phenomenal procedure.